Hello and good afternoon, everyone. Welcome to our webinar. I'm just waiting a little bit before we have more people joining us because I see the participants are going up and up. So I'll give it a few more minutes before we kick off. Okay, I see that quite a lot of people have joined us already. I'll kickstart without further ado, so you don't have to wait. Hopefully more people will join us along the way. First of all, good afternoon and welcome. Nice to see you all at our virtual event this afternoon, and Happy New Year. This is the first event of our Zooming in on solutions for the Affordability of Medicines series. So today we will be zooming in on competition as the road to affordability, which is organized by Affordable Medicines Europe. My name is Inelastic, and I'll be the moderator of this event and the discussion today. I'm joined today by my colleague Marisa Veloso, who will be our hypermoderator. For those of you wondering what hypermoderation is, I will pass it on to Marisa to explain to us.
Thank you very much, Shivram. Hello, everyone. My role today as a hypermoderator is to moderate the conversation that are coming from you, our audience, either here on Zoom, on the chats, on the Q&A, or on Twitter using the hashtag affordability. So please feel free to use the Q&A, the chat, and to engage with us online. Throughout the event, you can put your questions in the chat. I'm going to collect those and get in touch with you after the event at the end. We have a Q&A where you will get the floor to put your questions, and our speakers will reply to them. Also, because we want to hear during the event what you think, and we want you to be part of the conversation throughout the event, I'm going to be launching 3 polls. So please be ready to click your preferred answer. And of course, yes, we also want to know why you are doing a choice, one or another. So please feel free to let us know in the chat or on Twitter why you think the specific way. So before I pass the floor to Irem, I want to hear who is here today. So I invite you to introduce yourself in the chat and make sure to send like a message to all panelists and attendees with your name, your organization, why you are here today, and well, why not share your LinkedIn account so we can stay connected after the event. I will send mine now, and I'm very curious to see yours. Thank you very much, and this is all from me now. Irem, you're muted.
Hello, can you hear me now?
Yes.
Okay, sorry, I was just thanking you for the introduction. And before we kick off the event, I also wanted to share some standard housekeeping rules to make you aware of. Our event will last approximately 1 hour and 15 minutes. It will be recorded, as you can see on your screen probably right now. Your cameras and microphones are muted by default if you are part of the audience. If you would like to ask any questions, as Marisa mentioned, you can ask it in the Q&A or the chat box below. And if you would like to ask your question in person using your camera and microphone directed to our panelists, please let us know. You can just put your virtual hand up when we get to the Q&A session, and our technical team will allow you to turn your camera and microphone on to be able to ask your questions in person, and that always gives a nice, vibrant environment. So we encourage you to do that. Okay, so now we have some very great speakers lined up. They will be sharing their knowledge, expertise, and their opinions on the topic. So I don't want to keep you any longer. And before we start, I would like to give a very warm welcome to all the speakers. And I would like to invite Casper Ernest, the Secretary General of Affordable Medicines Europe, to give his opening remarks.
Thank you very much, Hiram, and good afternoon, ladies and gentlemen. Many thanks for joining this first event, which we have dedicated to the affordability of medicines. Especially welcome on behalf of Affordable Medicines Europe for this event, which is the association representing the parallel importers and exporters of medicines, as we are hosting this first event. Why are we doing this? Well, one of the goals of the Pharmaceutical Strategy is indeed to bring more affordable medicines to patients across the EU, and that is partly because of the continued increase on the strains of public health budgets in the EU member states, which has become a central issue in the political debate. And therefore, we are trying to zoom in on solutions on how to address these affordability issues. The series will consist of 3 webinars in total, each of which will take a deep dive into a specific area when it comes to contributing to increased affordability. So next Tuesday at 2 p.m. Will be the webinar, which focuses on transparency, which will be hosted by the European Alliance for Responsible R&D and Affordable Medicines, which is hosted as a secretariat by the European Public Health Alliance. And in 2 weeks, the last webinar will be hosted by the European Association of Hospital Pharmacists, focusing on how public procurement will be able to foster better affordability in the long run. But for today, we're focusing on competition in the pharmaceutical sector. We believe that competition is one of the key deliverables of the strategy. The Commission has already mentioned several points where spurring competition is necessary in order to deliver. But these are primarily linked to off-patent products. We consider this to be, let's say, a challenge, since we know that a lot of the affordability challenge is on patent products, which keeps taking up an increasing share of the medicines budgets in member states. Just to give a few figures, in 2011, the 1% most expensive specialized medicines consumed 32% of the European healthcare budgets, which in 2018, in just 7 years, had moved to 47% of the budgets. So we are spending more and more on the most expensive medicines. And therefore, we think it's interesting to look at how we actually can also spur competition in the on-patent segment, and to ensure that we utilize fully the internal market for on-patent products. And so therefore, specifically, we'll zoom in on the main competitive force that we have on the on-patent market, which is parallel imports. This has been a unique feature of the single market since the 70s, and we think it deserves a central role in ensuring competition forward as well. Just a few words on the size of our sector. Here you see the pharmaceutical sales in euro billions over the last decade, ex-factory prices. And in the next slide, you'll see that the parallel import sector has, so if you can take the next slide, has remained more or less stable over the past decade at around 5.5 billion euros. So in the last decade, if you take the next slide, you will see that our sector as a share of the total pharmaceutical market has actually fallen. We think that's a shame for the competition in the pharmaceutical market, and we believe that if we utilize parallel trade better, we would actually be able to increase affordability significantly across Europe. Probably one of the most interesting aspects is that parallel imports is becoming a European-wide phenomenon. Is not just the old EU 15 countries that are doing parallel import, but also the new EU 12 member states are importing. If I mention, for example, Poland, it has a significant import market, and alone in 2018, where we did the last saving studies, they saved 124 million euros in just 1 year from parallel imports. So it's really becoming something that every member state in Europe can benefit from. I won't go into any detail on the competition now. I leave that to our very, very distinguished panel of experts. And so I'm just very happy to have with us the experts on competition policy, economics, as well as experience from the payer side. So thank you very much for agreeing to speak. And then finally, I would just again like to thank everyone for joining, and I hope you'll contribute to an interesting, enlightening, and informative debate. Thank you.
Hi, good afternoon, everyone. Thank you for the invitation. I am very delighted to participate in the webinar and to reconnect with the association after such a long time. As you can see, I'm a professor at the University of Bologna, as well as officer at the Italian Antitrust Authority dealing with the pharmaceutical sector. So I will present the status of the case law, of the European case law, especially on parallel trades, specifically dealing with the pharmaceutical sector. So next slide, please. Just briefly, for those who are not familiar with the concept, with the notion of parallel trade. Parallel trade is a specifically EU phenomenon that from the economic point of view is based on the price differentials that are still observed within the internal market for the same drugs sold in different countries, in different EU member states. But from the legal point of view, the basis can be found into the provisions of the treaty dealing with the free movement of goods that was further developed by the European Court of Justice in the regional exhaustion of intellectual property rights. This legal framework has created a very, very favorable environment for the development of parallel trade, especially in a market like the pharmaceutical one, where price differential are more prominent than in others. In the next slide, we can see a visual example of what I'm trying to convey to you. Next slide, please. Yes, price differential. As you can see, this is a study from the Swedish Pharmaceutical Dental and Pharmaceutical Benefit Agency. The types of drug are divided in two: those drugs that are still on patent, that are not subject to generic competition, and those products that are instead subject to generic competition. And surprisingly, you can see that also the second category of products deploys differences in prices if you look at country per country, although generics have entered the market and are supposed to exert price competition and level the prices. So even in the internal market, even after so many times of parallel trade of pharmaceutical going on, we still can observe these price differential, which partly can be reconducted to the fact that each and every country has its own institutional and legal system and pharmaceutical policy. In many cases, they are very different from each other. Next slide, please. Against this economic background, we had those the legal provision that I mentioned earlier, which were developed, as I said already, by the European Court of Justice, which built along many years, decades, a pretty robust and thorough policy on parallel trade. This policy was very much protective of parallel trade and based on the belief that being not only a form of free movement of goods, but an important form of price competition, this phenomenon should enjoy a certain protection, strong protection from the EU legal system. And here I indicated for you just some of the seminal cases that are at the basis of the subsequent case law that have been developed along the years by the European Court of Justice. Next slide, please. This favorable environment, some numbers have been already described by Casper, and the numbers I'm presenting here largely overlap. But here I'm presenting to you a more detailed picture. So this favorable legal environment permitted quite an important development of the market for parallel traded products. Here you can see different level of market penetration in the main involved countries in Europe. And some of them, an example for this is Denmark. Some of them exhibit a very quite an important market penetration from parallel trade. Since the phenomenon is based on price differences, it changes very much in terms of direction of the flows of it. In the past, it was mainly a south-north phenomenon, and then it was a south-northwest phenomenon, but now it's going towards more the northeast. Also, the Brexit changed quite a bit the picture, because the UK became solely an importer and it's not exporting anymore. Next slide, please. Okay, so against this background, what are the strategies implemented by the pharmaceutical companies? They are very diverse. We don't have the time today to see and discuss them all. What I listed here, at least we should consider the first three of the four that listed. The first one is the virtuous one. Virtuous, obviously, from my competition law point of view. This is the strategy, price accommodation that one would expect to see. So as long as the cheapest imported product arrives into the importing country, into the market, the response that should come from the originator should be to compete on price, and it should lead to the benefit that we are expecting from price competition. Sometimes the responses are not so virtuous, and then we have strategies that I indicated here as deterrence. That is, the company tries to increase the price of the product from the exporting countries, so that the price difference is reduced in a way such that there is no any more room for trade, that there is no scope for arbitrage. Or another strategy is the third one that I listed, and it's it's a set of strategy that can be classified as a supply management strategies. That is, companies are trying to reduce the scope for parallel trade by implementing quotas, by refusing to supply the traders, the wholesalers that are exporting abroad. Fourth, but there is no time to discuss it, unfortunately, sometimes originators, they are just launching trademark legal action to protect their trademarks, alleging that the traders are unlawfully and illegally using their trademark, manipulating their trademarks in their country where they import. Next slide, please. All these strategies have been always there, and as I said, have been the object the object of the scrutiny of the European Court of Justice. And as I said already, there has been a case law robust enough that had been developed along the years. That was, until the beginning of 2000, considered to be quite established and not under discussion any longer. And this case law would say that any agreement, any bilateral agreement between companies, between undertakings that would impede parallel trade would be considered anti-competitive biobject under Article 101 of the Treaty of the Functioning of the European Union. Just for the sake of those who are not familiar with the antitrust jargon, being anti-competitive biobject means, from a burden of proof point of view, that the European Commission or a national competition authority is not bounded to prove concretely the effects of that agreement. So negative effect on competition can be presumed, this means that it's much easier as a burden of proof. Before 2000, there hadn't been any case on Article 102. There is on the abuse of dominant position, but the case law on the refusal to supply was clear enough that could be easily predicted that any unilateral conduct coming from a dominant pharmaceutical company aiming at hampering parallel trade would be caught by Article 102 and classified as an abuse of dominant position that could not be justified, exactly because it would aim at impeding or putting an obstacle to parallel trade. So everyone was quite sure of what was the treatment, the legal treatment of restrictions to parallel trade, until two new cases where subjected to the scrutiny of the antitrust community and of the European courts at the beginning of 2000. I'm referring to the Glaxo case and to the Lelos case. Yes, thanks. Next slide. So just that, no, sorry, the slide before, thanks. Directly to the fact, the Glaxo case, the case is very known as the Glaxo dual pricing case. What do I mean by dual pricing? Let's give it a concrete example. Let's take the first drug indicated in the first column, second row, Becotide inhalation. And then you can see second and third column, two prices, domestic sales and exports. Now, by the way, the case took place in Spain. So it was Glaxo supplying its product to the Spanish wholesalers, and it was supplying it at two different prices. So Becotide at the prices of €2.03 if the product would be sold in Spain, or at the price of €13.49 should the product would leave the domestic, the Spanish territory and be exported. That's why dual pricing. So the same drug with two different prices according to the final destination where the product would be sold. This was obviously reducing to zero the price difference between this the products sold to Spanish wholesalers but destined to the importing markets, and the price of the same product in those importing markets charged by the originator. So there was no scope for arbitrage anymore. So indirectly, there was not an export ban, but a dual pricing was establishing de facto an export ban. And for this reason, it was considered by the European Commission as an impediment to parallel trade, and specifically an agreement that was restrictive by object of competition, therefore violating Article 101. Upon appeal, next slide, please. However, the Court of First Instance overturned completely the analysis of the European Commission, and for the first time ever, it affirmed that a restriction to parallel trade, and that specific restriction, was not anti-competitive by object, but just by effect. That means the Commission should have proven the effect of the restriction. And this was because there was no proof of the fact that there was a real competition coming for parallel trade, and this was because of the presence of regulation. Also, the court said that the European Commission did not investigate the relationship between parallel trade and innovation, namely whether it would undermine the R&D incentives of the companies that were subject to this price competition. Next slide, please. Another case under Article 102 this time, a Greek case. We're more or less in the same years as the Glaxo case, the Lelos. So Glaxo in Greece started stopping supplying the Greek wholesalers we were exporting in a first phase of the conduct. In the second phase of the investigated conduct, it did not really stop supplying, but established some quota. It was fulfilling part of their orders that were submitted. The motivation for this refusal or these quotas were that Glaxo was willing to impede parallel trade. Obviously, the case was put at the attention through a preliminary ruling, the attention of the European Court of Justice. Next slide, please. And during the discussion, or at least the Advocate General presented its opinion to the court, and in its opinion, it drew very much from what the Court of First Instance already said in the Glaxo case that I mentioned earlier, and said basically the same thing. So that also in that case, no presumption of benefits in terms of lower price that could come for parallel trade, again, because of the presence of price regulation. It also added that the same regulation, the fact that there was regulation imposing, the specific regulation imposing a public service obligation would lock in pharmaceutical companies, namely that they were obliged to put onto the Greek market certain products which were requested by the patients and therefore by the pharmacists and therefore by the wholesalers. So they could not refuse to supply because of a public service obligation, but those same product would take the way of the northern importing countries. So somehow the companies were locked in this vicious circle, let's call it that way, and could not defend their profits. So also in this case, it should have been investigated whether the diminishment of this profit, to which that was inevitable for the companies due to the regulation, could have undermined innovation. If so, then a refusal to supply could have been considered to be objectively justified. So next slide, please. At that time, there was a sort of little revolution that seemed to go on, because this the opinion and the decision of the Court of First Instance seems to put in creating a sort of overturn in the case law. The case law that, as I said, was well established since 40 years. But this overturn seems to be special or destined only for the pharmaceutical market. It seemed that that market was considered to be somehow special with respect to the others, and this was precisely because of the fact that we have price regulation, a pervasive price regulation, because prices are finally set by the member state. They fall outside the player supply and demand, and they are structurally at a different level in each and every EU member state. Next slide, please. Now, the question from the factual point of view, is it really correct to affirm that the pharmaceutical market is special for those reasons? Well, if we analyze the pharmaceutical regulation, we can see that statutory pricing are not the rule. In many countries, prices are negotiated. So between an agency or between the government and the pharmaceutical company, and this interplay mimics exactly the interplay that you have between supply and demand. And this is the first point that we have to take home. Next slide, please. Also, we have to consider there is specific national legislation that is specifically enacted in order for the national healthcare system to enjoy the benefits coming from cheaper products, such as parallel traded products. One of them is, for instance, the German mandatory quota that provides for the certain quota to be dispensed, to be sold. A share of the sales of the pharmacies that should come from a parallel imported product, exactly because they are cheaper. And if they are cheaper, lower, the price is lower than a certain threshold that is established by the law. But I guess that this would be discussed later on today in further details. This is an example that I just that I can make. I could make more, but I think that I would run out of time. So next slide, please. Also, empirical analysis shows that there are savings and there is price competition coming from a parallel traded product. As you can see from this graph, the red line is the price of the originator, and the yellow line is the price of the parallel imported product. As you can see, as long as the parallel trader entered the market, the price went down. And if we go to the next slide, this is even clearer. Look, exactly. This is from an example. This was from the previous one was from the German market. This is from the Danish market. As you can see, in the moment in which you have the parallel trader coming in the market, then there's a price war, a price competition that starts and brings down all the prices. And this generates both indirect and direct savings. Indirect because you have the price, the market price that goes down. So either the national healthcare system reimburse the originator's product or the parallel traded product, it will be anyway a cheaper product. Next slide, please. Okay, so second issue. So from this, I think that having analyzed the framework and the empirical evidence, I think that it can be said, contrary to what the Advocate General said, and the Court of Instance said in the Glaxo case, in the Lelos case, that we can presume that there are benefits in terms of lower price coming from parallel trade. What about the link between parallel trade and innovation? This is the most difficult part. It's very difficult to say. Here I present some calculation that have been that come from the literature of the profit loss in certain countries coming from parallel trade. Against this, it is always repeated also in the literature that it is very costly to develop a new drug. Next slide, please. So we should expect that less profit should chill the R&D investment. Let's have a look quickly what the Commission has done in the Glaxo case. The European Commission took a so-called historical approach. That is, it looked at the budget from the company, and so whether in those years where when the facts under scrutiny took place, which was the end of the 90s, that is when the competition took place between the parallel traders and the originators, when the dual pricing was implemented. Well, the budget, Glaxo's budget of those years did not show any diminishment, any decrease of the R&D investment. Actually, it showed an increase. And from this, the Commission drew the conclusion that parallel trade does not have any impact on R&D. However, the literature is includes papers that show from an econometric point of view that there is a link between competition exerted by parallel trade, diminishment of the profit, and the R&D incentive. Other papers qualify a bit this statement, some others contest it, question it. So we can say that from an economic point of view, from an economic theory point of view, there is no firm conclusion. Certainly, we cannot presume that there is a negative impact of parallel trade on innovation. At most, this should be proved empirically, that is, case by case. So, next slide, please. This has been reflected in both decision in the Glaxo and in the Lelos case, because in the Glaxo case, the European Court of Justice overturned the Court of First Instance decision, and it said that actually it can be presumed that parallel trade brings benefit, brings lower prices, and therefore any agreement restricting it is an anti-competitive biobject. However, the court asked the Commission to check the link between parallel trade and innovation because it thought it was not investigated enough. The Commission never performed this task. In relation to the Lelos case, next slide, please. The court also said that unilateral restriction, so from dominant companies to parallel trade, are anti-competitive, so also based on the fact that parallel trade brings about savings. But companies are allowed to defend their commercial interests, and therefore, if they are certainly not allowed to entirely stop supplying their commercial partners, but they can establish quota based on the size of the market and on their previous commercial relationship, meaning that if they establish quota and these are reasonable, and if the orders submitted by the wholesalers are not out of ordinary, the quotas are legitimate as long as they are reasonable, and the orders of the wholesalers are also reasonable if they are not out of ordinary. So there is the court is trying to strike the balance between the two parties, allowing a certain amount of parallel trade to take place. and this certain amount should not diminish too much the profit of the company. It should be noted that the court did not say anything about innovation, about the link between parallel trade and innovation, precisely because it's very difficult to establish a clear causal relationship. So next slide, please. The case law, these cases might seem to you quite old, but they are so far where the case law is. Also, the national cases that were dealt with by national competition authorities, by national courts, largely follow the indication of the court in both the Glaxo and the Lillos case. So we are stuck at that moment. So what is the take-home message? So those little revolutions did not really entirely took place, because we can still say that we can presume that parallel trade brings benefit in terms of lower prices for patients and for the national healthcare system. So the effect in general, the welfare effect, consider overall should take this into consideration and be balanced out with the potential effect on innovation, which, as I said, it's very difficult to demonstrate. So any restriction should be allowed or maybe prohibited on depending on the balance, on the outcome of this balance. Thank you very much for the attention. I hope I didn't steal too much of the allocated time. Of course, I'm here for any question, if any. Thank you.
Thank you very much for your presentation, Ms. Lezogus. We are a little bit running behind the time, but don't worry, we will catch up. So it was very insightful and interesting cases that you shared. I think it was very valuable for our audience. Now we would like to get the audience involved. So let's see if they were listening careful enough. We have prepared 3 poll questions for this event, and we would like to ask you now the first one. And I'll hand over to Marisa to ask the question.
Thank you, Rem. So yes, we have the first question ready for you. You can pick one answer, and the question goes like this. Do you think that delivering on the affordability of medicines must be a priority of the upcoming revision of the pharmaceutical legislation? The possible answers are yes, no, or don't know. We posted this poll also on Twitter last week to see what our online audience thinks. Feel free to go check out the social media channel of Affordable Medicines Europe and to use the hashtag affordability to engage with us. So I'm going to let the poll run for a few more seconds, and then we'll show you the results. So on Twitter, when we posted this post, we had 60% of the people that voted yes. I don't want to bias or influence you, but I'm keen to know what you think here today, if it's the same or different. And also, we would like to know why you are choosing one of the answers. So feel free to let us know in the chat, or to engage with our tweet, our poll on Twitter by using the hashtag affordability. Yeah. So 20 out of 35 people voted. It's not really increasing anymore, so I think we can close the poll now, and we will show you the answers straight away. I see that everybody clicked on yes, so you are aligned with our online audience too. Very happy to hear that. I invite you to let us know what you think about this result, and also why you have chosen this in the chat. Thank you very much.
What a resounding yes that is. Thank you all for participating. If you enjoyed the poll, stay tuned for more questions to come. Now I would like to introduce our next speaker, Mr. Soren Breno from Copenhagen Economics, who will give a short presentation on his recent studies on savings in Finland and Denmark and his main findings. Thank you for joining us.
Thank you very much for that kind introduction. I hope that you both hear and see me now.
Very well, thank you.
Thank you. Can we have the next slide, please? So I've been looking forward to delivering this presentation to you today on the economic impact of parallel imports of pharmaceuticals from a payer's perspective. Next slide, please. If I'm just a small guy in the corner of your screen, here I am in a larger version. My name is Søren Brenø. I'm a senior economist with Copenhagen Economics. I've been with the company for about 7 years, working on a range of different projects over that period of time, often in the field of quantifying things that are difficult to quantify, be it the impact of new treatments, products or activities, as in this case, working for life science companies, public institutions, and patient organizations. By training, I'm an economist from the University of Copenhagen and from the College of Europe. Next slide, please. So Copenhagen Economics is one of the leading economics consultancies in Europe. I have about 90 colleagues, and all of our consultants are economists by training like myself, and we operate from across our 4 offices in Copenhagen, Stockholm, Helsinki, and Brussels. Next slide, please. We strive to be the best in 12 different service areas that you see here. And next slide, please. The one that I am part of and where we've done this work on parallel imports of pharmaceuticals is in the healthcare and life sciences space. Next slide, please. Today, I'd like to touch upon 4 issues. First of all, parallel imports of pharmaceuticals from an economics perspective. So what is it? Secondly, I'll turn to the economic impact of parallel imports. So what does it do? Thirdly, I'll turn to the role of regulation in Denmark, which we find has a great impact on parallel imports. And I'll finalize by addressing 2 crucial assumptions that we find need to hold true in order for our results to be valid. And I hope to convince you that these are reasonable. Next slide, please. So as Claudia mentioned in her legal presentation, parallel imports is basically the practice of arbitrage stemming from price discrimination by the original manufacturers. So obviously, if you can buy something inexpensively in one market and resell it at a higher price in another, you have a good business case going, and in other words, that's arbitrage. So next slide, please. Let's take an example in Denmark. So let's say there's a direct importer that sells products to a wholesaler in Denmark, reselling the products to pharmacies in the case of the pharmacy sector, and eventually sells these to the end consumer, to the patients. That would be the normal route to market. Next slide, please. So the alternative way, or what we would consider as parallel imports, is when the direct importer sells to a wholesaler in, let's say, the Netherlands, that then resell these products to a parallel importer that then resells it to the wholesaler in Denmark, from where the process is the same as before. So when will this longer route to market via the parallel importer take place rather than the direct one? Well, that is when the price charged by a direct importer to a wholesaler in the Netherlands, so that's arrowed straight down, plus the Dutch wholesaler's profits, plus the parallel importer's profits is, next slide please, lower than the price charged by the direct importer to a wholesaler in Denmark. So the line directly from the direct importer to the wholesaler in Denmark. When this condition holds true and the price differential is sufficiently large, there's an economic case for arbitrage, or in this case, parallel import. So that's a crash course in the economics of parallel imports of pharmaceuticals. Next slide, please. Then I'll turn to the economic impact of parallel imports. And before we dive into that, I'll give you also a crash course and a bit of terminology in this space. Next slide, please. So if we consider the Danish primary sector, if there are sales by a parallel importer, it's because a parallel importer has placed the lowest bid in a bid round. This has then obviously been lower than that of the direct importer. Next slide, please. And we can observe this price difference, and we can calculate how large, or we can observe how large it is. Next slide, please. This is what we call the direct effect. But there's another effect, as Claudia also mentioned, because the direct importer might react to the competitive pressure by parallel importers by decreasing their price. That's what Claudia showed as a real world example. So that's a strategic effect or a strategic response of the parallel importer. And we call this second effect the indirect effect. Next slide, please. So the indirect effect differs from the direct one in that we cannot observe it. So we need to estimate it. We cannot observe the direct importer's monopoly price because they actually set a lower one, but we can estimate it. The indirect effect is just as real and tangible as the direct one, but due to us having to estimate it, it's associated with a higher degree of uncertainty than the direct effect. Next slide, please. Summing these two up, the indirect and direct effect, we get the total effect. Next slide, please. So in the case of Denmark, we found that according to our calculations, the total savings from parallel imports of pharmaceuticals in 2018 amounted to 610 million Danish crowns, equivalent to 82 million euros, or 3% of the total expenditure on pharmaceuticals in Denmark. Breaking these results down, next slide, please. We find that the majority of the savings take place in the primary care sector. That happens for two reasons. First, because the parallel importers' market share is much larger in the primary care sector than in the hospital sector. And secondly, because the price differential between the original manufacturers' price, the prices set by the original manufacturers and the parallel importers are greater in the primary care sector than in the hospital care sector. We also see that the total savings are more or less equally distributed between direct and indirect savings. Next slide, please. Looking at the hospital sector, which constitutes the rest, a smaller fraction, is a saving of 65 million DKK, which are predominantly indirect savings. Next slide, please. Summing these up, we get to a total saving of 610 million Danish crowns. Next slide, please. So all of this we put in. I see there's a bit of formatting issues that happen to these slides. Back one, please. But I hope you managed to read it despite of being outside of the box. Please come back to where we were before. There we go. One back. No, that was forward. Two back, please. There we go. So all of these results that I just showed now, we put into a report called the Economic Impact of Parallel Imports of Pharmaceuticals and Assessments of Savings in Denmark. We did this study back in 2019 on data from 2018. We actually just now commencing another piece of work where we'll be updating the data with the analysis with data from 2021. So it'll be interesting to see whether Denmark follows a trend that Kasper shared on a decreasing share of parallel imports or not, but we are soon to find out. In the meantime, we developed another analysis, next slide please, in Finland called Laikiden rinnukaistunin sastotuomesa. And for those of you that are not fluent in Finnish, next slide please, that's also savings from parallel imports of pharmaceuticals in Finland from 2016 to 2020. Next slide please. Here we find total savings of 41 million euros over this 5-year period from 2016 to 2020. And you may wonder, is that not exactly half of what we found in the case of Denmark? And I have to say, yes, that was 82. And is this not over a 5-year period? Yes. So annualized in Finland, we find an impact that's about 1/10 of that in Denmark. And we're comfortable with that result, as the revenue of parallel importers in Finland is about 1/10 of that in Denmark. So in Finland, we also find that the majority of the savings, 31 out of 41 million euros, come from the pharmacy sector and the remaining from the hospital sector. Now, I claim that we are pretty good with numbers in Copenhagen economics, so it's not that we cannot calculate, but due to roundings to the nearest million, that these numbers don't add up. We were able to split these savings, next slide please, by type, as we did in Denmark, and similarly we see that there's a more or less an equal split, but an overweight of indirect savings also in the Finnish case. And next slide, please. We were in the Finnish case also able to split the savings by beneficiaries, where we see that the consumers, 17 of the 41 million euros accrue to the consumers paying lower prices at the pharmacies. So these are all pharmacy sector savings, and the remaining 23 million euros accrue to taxpayers. Next slide, please. So those were the green results from Finland. Now we're back to the blue color theme for Denmark. And I'd like to just attach a few words on the role of regulation. Next slide, please. So next slide, please. In the primary care sector, the length of the supply obligation is just 2 weeks. And in case of supply shortages, there are no sanctions on the provider. Also, pharmacies have a legal obligation to dispense the cheapest alternative. Next slide, please. And this is associated with a parallel importer market share of 26%. Next slide, please. If we turn to the hospital sector, this supply obligation is much longer. It's 1 year, and the purchaser has an option to extend this with an additional year. And in case the provider is unable to supply, there's a fee corresponding to the losses incurred by the payer. Next slide, please. This is associated with a 7% market share. And to me, this is a clear indication that the regulation put forward is detrimental or important for how the presence of parallel imports turns out. Next slide, please. Lastly, I'll turn to two crucial assumptions. Next slide, please. That need to hold true in order for our results to be valid. So first of all, we claim that the demand for pharmaceuticals is inelastic. That means that patients or consumers will consume more or less the same quantity regardless of the price of these pharmaceuticals. We argue that this is the case, firstly, because pharmaceuticals are often a necessity. It's not something you consume because you enjoy it. It can be vital to your health. So people tend to purchase what they are prescribed, regardless of the price. Secondly, next slide, please. Demand is not determined by you yourself, but by a doctor, and that also contributes to prices being less of an issue. And thirdly, next slide, please. Pharmaceuticals are predominantly publicly financed, at least in Denmark and Finland. So in case of any price changes, this will not be felt by the end consumer. Therefore, we make this assumption that the demand is inelastic. Secondly, we assume that the innovation budgets are unaffected due to the small market size in Denmark and Finland. And this is also something that Claudia touched upon, which may not hold true if you look at Europe as such. But consider the innovators' incentive to develop new therapies as a function of the parallel importers' market share. So given that on a global scale that parallel importers take up a larger market share, that will imply that innovators have poorer chances of price discriminating and hence deteriorating profits. Next slide, please. So that will create a downward sloping curve here. However, when we consider just Finland or Denmark, we would not imagine that the R&D center at a global pharmaceutical company would have their decisions altered by the presence of parallel importers in either of these two markets. Next slide, please. Why we assume that this line is flat. With these two assumptions in place, we should be home safe. Next slide, please. This is all I had to say. I'll be happy to take any questions or reflections from your side. Next slide, please. And if you find any of these studies interesting, you'll be able to find them on our website, copenhageneconomics.com, I'll be happy to develop any further studies of this kind for additional countries that you find interesting. And don't forget to follow us at Copenhagen Economics on LinkedIn, on Twitter, where we're pretty active both places. Thank you very much for your time and for your attention.
Thank you very much for this interesting presentation. And if you guys are interested, we are also happy to share the slide deck with all the attendees afterwards. So if you would want to have the information afterwards. I would like to now turn to our audience again and ask them a question, the second question for our poll, and I'll again hand over to Marisa for this.
Yes, thank you, Iran. So yes, time for our second question. We would like to know from you. So in your view, do we need more competition in the pharmaceutical sector to bring more affordable medicines? What do you think? Yes, no, or it makes no difference? Let us know what you think, and also feel free to let us know in the chat why you chose one of the three answers. So we also asked this question on Twitter because we wanted to know what people think beforehand. And the results were quite straightforward. I won't say it yet because I don't want to bias anyone. But let's say, yeah, people agreed on one specific answer, but some also had another opinion. I'd like to know what you think here today. So yeah, let us know. You can also engage with us online. We are tweeting on the Affordable Medicines Europe channel. We are retweeting the polls too. So if you want to give your opinion or explain to us why you choose a specific answer there, feel free to do so. We'd be happy to see you engaging. I think we can close it soon. Yes, thank you very much. So here, 81% voted yes and 19% voted no. Thank you very much. On Twitter, we had 75 people, 75% voting yes, and actually 25% voting no difference. So we see different results here. Would be interested to know why. Let us know in the chat. Thank you very much.
Thank you, Marisa, and thank you all again for participating. We have one other question that will come later, but we still have our last but not the least speaker, Mr. Ulrich Möhr, Deputy Director of Deutsche Sozialversicherung, Brussels. I hope I didn't butcher that word, who will be presenting his experience on the payer side. The floor is yours.
Yes, thank you very much, and very much thanks for the invitation here, and to all who listen, Happy New Year. The headline of my part is competition in the pharmaceutical sector experience from the payer side, and my side is the side from Germany. So I will spend a few words on our experiences. As we all know, the market for medicines isn't what we call a perfect market. We are therefore moving between competition on the one hand and regulation on the other. Today, I will speak about imported drugs and their impact on an economic dry supply in Germany, their role in the regulatory canon of the statutory health insurance. I will briefly introduce our regulatory instruments and conclude with our ideas on the meaningful development of a policy framework at European level. Next slide, please. In Germany, imported drugs are of high importance for the price competition and for the effective functioning of the market regulation. In addition to the import quota, Claudia remarked it, the most important regulatory instruments or pillars are discount contracts with individual manufacturers, refund amounts for drugs based on an early benefit assessment, and the so-called fixed prices that are maximum prices. Let me give you two examples which show how necessary imports for competitive market regulation are. First, importers are considered as manufacturers. They come into play in discount contracts when there is no generic manufacturer. They compete with the original manufacturers and can force them into such contracts. We benefit. A second example is imports with the lower prices. You have seen it in the last presentation, do positively influence the formation of maximum prices for certain groups of drugs, the fixed prices in Germany. We benefit too and indirectly. This shows the relevance of imported drugs for affordable prices and affordable medicines goes far beyond the potential saving achieved directly. And you can see in the blue triangle here, while about 8 billion euros in savings can be achieved via fixed prices, it is only 20 or maybe 30 million via the obligation to dispense imported medicines. But that's the direct side. Next slide, please. Let me briefly introduce how the different instruments we use work. The first pillar is the import quota. This quota depends on the proportion of importable drugs in a fund. If this share is 25% or more, then the import quota is 5%. Otherwise, it's lower. Then there is the 15-15 rule. That means at least one import must be 15 euros or 15% cheaper than the original. The savings target is 2% of the total possible savings in the importable market. If the import quota is not reached, a penalty duty is levied and immediately deducted from the invoice. So the result is our advantage savings are guaranteed, either through the imports or through the penalty duty. Next slide, please. The second pillar is formed by the discount contracts. Germany is the only country in the EU that concludes discount contracts. It works like this. The discount contract partner becomes the exclusive partner of the health insurance fund. If a doctor makes a corresponding note on the prescription, the patient no longer receives the drug from the manufacturer named on the prescription, but a drug from our discount partner. The drug has the same active ingredient, dosage, and package size, of course. And the health insurance funds can exempt these drugs from co-payments to give patients more benefits and an incentive. Imported drugs have a high importance for this discount contracts. They enable discount contracts in the non-generic market, as I said, where is no other competitor by forcing original suppliers to bid. At European level, discount contracts are often seen as a cause for supply shortages. Our view is different. In our opinion, they increase supply security. Next slide. The third pillar of market regulation in Germany is the negotiation of refund prices on the basis of so-called early benefit assessments. In principle, drugs are available in Germany immediately after approval and market entry in the SHI system. Within 3 months after market entry, the IQWiG, an institute working for our HTA body, assesses whether an additional benefit compared to the appropriate comparator therapy can be recognized on the basis of a dossier from the manufacturer. After a further 3 months, the HTA body makes a decision based on the benefit assessment on the one side and the comments received within a consultation process. In the case of proven additional benefit, the SHI and the manufacturer negotiate a refund amount as a discount on the original dispensing price. If no agreement is reached, an arbitration committee decides. If no additional benefit is determined, the drug is transferred to the fixed price system. On this later. If there is no suitable fixed price group, and this is quite often the case, the price is reduced to the level of the appropriate comparator therapy. As the chart shows, in about 64% of all cases, no additional benefit can be proven for new drugs or a benefit cannot be quantified. This is the blue area, dark blue and light blue you see here. Overall, this instrument has proved very successful. It has succeeded in stabilizing prices for drugs that are no better than existing products. Next slide, please. However, the early benefit assessment has its economic significance in connection with the instrument of fixed prices, as I said. This is the fourth pillar of market regulation in Germany. It's the oldest instrument and has been established since 1989. This instrument is used to group drugs into maximum price groups in 3 stages: same ingredients, comparable ingredients, and comparable effects. In the process, our HTA body determines the active ingredients and the combinations for which fixed prices are possible. After, our Central Association of Health Insurance Funds determines the amount of the fixed price. The lower third of the drug prices determines the amount of the fixed price to decrease market prices. At least 1/5 of the prescriptions and packages in the fixed price group must not be more expensive than the fixed price. That's the rule. If the pharmacy retail price of a drug is higher than the fixed price, the patient must make an additional payment. If the price is 30% below the fixed price, the patient does not have any have not to pay the usual co-payment. What we have seen is almost all manufacturers since 1989 have adjusted their price to the fixed prices. Fixed prices are reviewed regularly. This is necessary because the markets change. Sometimes they are adjusted politically as well. The last adjustment last year alone generated additional savings of 200 million euros. The fixed prices are the most important price regulation instrument for the German health insurance system. With them, a permanent price break was established and savings around 8 billion euros per year. And these savings are cumulative. Next slide, please. You know, at the end of 2019, the European Commission presented its pharmaceutical strategy. This will result in comprehensive pharmaceutical legislation this year. The strategy addresses the following topics: meeting unmet medical needs, access to and affordability of medicines, competitiveness and innovation of the industry, crisis preparedness, strategic autonomy, and more. One major issue is, of course, drug prices. In view of market developments in recent years, our price regulation instruments are in danger of failing, especially for new medicines. If we look at which drug group incurs which costs, we get indications of where there is an urgent need for action, at least financially. As you can see in the chart here, the highest costs by far are for orphan drugs at over 200 euros per daily dose. But even in the case of patent protected drugs, there are price outliers where our regulatory instruments are not effective. The most prominent example here was provided by the company Gilead. Next slide, please. We, as the German social insurance, are naturally involved in the ongoing discussions on the future direction of pharmaceutical legislation. The German social insurance system stands for functioning drug competition and proactive monitoring of supply shortages. We stand for affordable drug prices and the elimination of disincentives for orphans. We stand for centralized drug approval based on sufficiently valid study findings and targeted promotion of innovations with proven additional therapeutic benefits. Particularly in the case of new drugs, we see that pricing can lead to socially unacceptable results. Where price regulation mechanisms fail, we need solutions that take into account transparency about the costs of pharmaceutical companies, given tax reliefs or subsidies received, realistic payback periods in which the investments made must be recouped, and a common understanding of what profit margins are appropriate. On this basis, prices can be determined that are socially acceptable and do not overburden healthcare systems. So, and now I have to say thank you for your attention, and I'm open for questions.
Thank you very much for this interesting presentation again. Actually, we have one last poll question to ask to our audience, and then we will move on to Q&A to get your questions for our speakers. I'll pass on to Marisa to ask the final question of the day.
Thank you very much, Irem. That's correct. I have one last question for you before we are going to address yours. So the question is, do you think that the upcoming revision of the pharmaceutical legislation should also look at how competition can be spurred for on-patent products? Yes, no, or I don't know. Let us know what you think. I know some of you might be tired. It's Monday, but we really appreciate having your opinion on this. Let us know why. Yes, why no, or why you don't know. Could be interesting. And yes, we are going to. I already received some questions in the Q&A function here. Feel free to continue dropping questions. We have a bit of time to address those, so it's not too late. And of course, if you want to address them personally, give us a sign, and we will let you speak and show you on the screen. I think we can close the poll now, and we see the results. So it's a clear yes, but 2 people said no and don't know. Feel free to let us know why. Thank you very much for participating in these polls. Very appreciated. Irem, I think now you can continue and announce the Q&A.
Yes, thank you very much for participating. It's always interesting to see the results and also compare them to Twitter. Before we close this event, we also want to give the floor to you and answer some of the questions that you've asked us on the chat and the Q&A. I think there have been a couple of them, so I'll leave Marisa to read them to our panelists. And if you would like to ask your question in person, as I've mentioned before, please feel free to raise your hand and we will give the floor to you.
Thank you, Irem. So we received a question, and I believe it's for Claudia. The question is it possible that PT didn't affect the investments in R&D because Glaxo is a global company, while other SMEs might not take the same business decisions? Maybe a case-by-case evaluation needs to be considered. Thanks.
Indeed, that was the message I intended to convey when I said that the link between parallel trade and innovation should be proved, if any, empirically. Empirically means that you cannot just presume that it exists, but you have to prove it specifically for the specific case. So the answer is yes, I agree with the comment of the participant. There should be a case-by-case analysis. Whether it can be actually done, this is something that can be also discussed, because the fact that the Commission did not perform the task that it was demanded by the court is quite a sign of the fact that also from an empirical point of view, the link it's hard to demonstrate its existence. I hope I answered the question.
Thank you, Claudia. I think you did. If not, feel free to flag it or drop another question in the Q&A section and we will address it. I have another question. This one I think is for Ulrich, specifically about the Germany system. If there is no additional benefits, therefore there is something to be compared with, why the less advantageous option is kept on the market? Is quality of life considered in these evaluations? Thank you very much.
Yes, thank you for the question. It's a quite complex system to prove the additional benefit. It is made by comparison to existing drugs and existing therapies. And yes, there are different aspects which are proven, and life quality is one of them. And so if the tests come to the result that there is an additional benefit, and they differ between a big additional benefit and more or less a little benefit, then they give advices for the pricing committee.
Thank you very much. Thank you very much, Ulrich. Just taking a look at the chat and the Q&A. I have one more question for Søren. And the question is your estimation of savings in Denmark and Finland conservative? And therefore, does it estimate an amount which is probably less than the real one?
Short answer, yes. Longer answer. In some parts of the methodology, we are able to quite exactly quantify the effects or savings accruing to either the taxpayers or the public healthcare system. In other areas, there's some uncertainty, and we may need to make assumptions or to use an estimate. And in those cases, we always make sure to take a more conservative approach to make sure that we don't overestimate the effects, and to ensure a high degree of credibility of the results.
Thank you very much, Søren. If anyone wants to ask any other question, feel free to drop something in the chat, the Q&A. I don't see any hands raised, so I believe nobody wants to ask the question in person. So
I think maybe I can already slowly intervene, Marisa, because we are running a little bit out of time. If you have any questions that are not answered, please feel free to let us know in the chat or maybe online afterwards, and we will try to get back to you as quickly as possible. But for the interest of time, unfortunately, we have to wrap the Q&A session. Nevertheless, like I said, don't forget that we still have our Twitter. Using our hashtag, we will be monitoring the conversations, and we would be happy to engage with you there. I would now like to leave the floor back to Casper for his closing remarks on the event.
Thank you very much, Irem. So I will make this short. We are already a few minutes over time. So thank you everyone for tuning in. Thank you very much to our speakers. I think this was very interesting presentations and you know, very interesting insights as well to what they have been doing over the past years. I think all the interventions have showed from different perspectives how imported medicines can be the competitive force in a quasi-monopolistic market. And so I think we have also seen and made studies of other countries, as I mentioned earlier, Poland, but also Denmark, Finland, Germany has also been made, and Sweden has been made. So really savings across the board, and that if we could increase the take of parallel trade, we would also be able to foster more savings in general. So feel free to check out our publications on that. All of them are made by economic agencies, not by ourselves. And then just finally, I think also someone has commented, Lieven has commented about accessibility. And yes, accessibility is a key issue as well, of course. I personally believe that affordability is becoming an issue for accessibility. I believe that medicines are now at a price overall where the payers are really struggling, and where they have to prioritize actually the access to medicines. And so I do agree accessibility is the key issue, but I do believe that affordability is one of the main topics that needs to be addressed to ensure further accessibility. And of course, competition and economics is not the only aspect. So with that good comment, to which I fully agree, I would say thank you very much for today, and thank you for participating in the debate. And then I'm looking very much forward to next week's webinar, and I give the torch, so to say, to the European Alliance for Responsible R&D and Affordable Medicines. Thank you very much for joining.
Thank you, Casper, for your closing statements, and thanks to all of our speakers and participants for joining us this afternoon. The next event of the series will take place on the 18th of January, exactly 1 week from today and right now, at the same time, same venue on Zoom. The registration link to the program of the event are available on our website, and I think they will be also shared with you on the chat right here as well. You can always find out more about the event series and follow up on the conversation offline on our social media channels that were shared with you already. We look forward to welcoming you all here again next week, and thank you all for your time today, and have a great evening.
Thank you all.
Thank you.
See you next week.